This is Dr. Andrew Young at St. John's, and we wanted to make a very important video about the type of work that we do at St. John's, specifically in terms of the teamwork that happens at St. John's when a patient gets a joint replacement. Now, I am the front person as the surgeon, and so much of the attention comes to me. But the reality is there is an entire team of people supporting me and supporting the patient. Sometimes behind the scenes, sometimes not so behind the scenes. It's been said that it takes a village to raise a child. In the same way, it really takes a team working closely together to bring a patient through an episode of care after joint replacement. I just want to share with you some of the people on this team, what they do, and how they take care of you. So supporting me is not just my team, but it's also my family. This is one of my favorite pictures. This is my son Jake. He's a bit older now, but he's been coming with me on weekends to the hospital since the age of 2. And he helps me take care of patients. And the hospital saw it like this. They said it's his precision as an elite surgeon that puts people back on their feet. But my favorite part about this was the second part. It was that the dedication of my team moves them. And I think that really captured how we work together as a unit to take care of people. So this is me on a surgery day. And on surgery days, it's game day. I'm very focused. I really don't talk to anybody. I try to keep my mind on the task at hand. But at the same time, there are so many people around me here to take care of the patients, take care of me, to make sure everything goes well, smoothly, reproducibly, and predictably. They are all completely wonderful people at all the different levels of care, whether nursing, anesthesiologists, hospitalists, staff, environmental services, valet, everybody at St. John's is working together for the benefit of the patient. And this is a big part of the team. And this group has been together. We've been working together for 16 years. And as a group, we have done more joint replacements than any other group in the United States at this time. We've been together for years. Each year we do thousands of joint replacements. And why is the experience important? It's because this is a group of veterans who has seen everything. They know exactly what to do. They know how to take care of patients. There's no dabbling, there's no dawdling. Everything is precise, everything is methodical, and everything is planned. There is no stronger or more experienced group of people than this. But at the same time, we also know our strengths. We also know our weaknesses. We also try not to take ourselves too seriously. We can sometimes see ourselves for the cartoon characters we are. This is me, the short guy on the side, and then in the center is Eric, and you'll probably see Eric as he walks around with me as my assistant. And as we go out through the day taking care of patients, we also know that it's important to take care of each other, where you have time to laugh, to make fun of each other. Eric loves to do this. And whether it's jokes or smiles or hugs, it's what feeds us to get through the day so that we have the energy and the reserve to take care of patients. What is the role of meetings? We think meetings are very important, but we really dislike meetings. We're a clinical team. We focus on each other and we focus on patient care. This is probably the closest I'm ever going to get to a meeting. This team not only takes care of patients, we take care of our community. On this weekend, everybody came in. They gave their weekend so we could teach the local middle school how to use robotic technology. This is Jake. He's part of the robotics club. So we brought their team in and we showed them the application of robotics in real life. And then these are the people who gave up their weekend to teach the kids. These are all generous, wonderful people at so many levels. And living in the West Coast with St. John's and Santa Monica, sometimes we like to go to the beach. Actually, I don't like the beach. I like going home. This is my family, my wife, and my 2 kids. And This is where I spend all my time after work. I don't go to the beach. And very importantly, it's also important to note that there's teamwork at so many levels. There's the team that takes care of patients, but there's also the team that supports the surgical team, whether it's in X-ray, whether it's in environmental services, whether it's nursing. It's all the different people working together to take care of the patient. And I think what I really want to convey is that I am the front person. I try to be very serious and focused because that's my responsibility in surgery. But there's probably so much happening that none of you get to see. It's the people behind the scenes that have such love and care for not just the patient, but also for each other. So I couldn't be prouder of the people I work with, and I'm so grateful for the way they support me, for the way they support each other, but really importantly, for the way they support our patients. Thank you.